how do I know that my baby is sick? This is the most frequently asked question by my young parents who leave this hospital with their bundle of joy. Now, what I usually tell them is that the gut feeling that you have, or that your baby is sick, or when you feel that there is an abnormality, a change in the normal behavior of your baby, that is the most important for you to most important time for you to go and call your pediatrician. Myself, Dr. Alokananda Das Dutta, consultant pediatrician and a neonatologist at Apollo Multispeciality Hospital, Kolkata. What I sensitize my parents, young parents, that when there are some normal behavior in babies which can be alarming in adults. Like baby can have 16 to 18 hours of sleep in a day, and they will only wake up when they have to feeds, and when they are passing their urine and stools and like to be changed. They can pass 10 to 12 times of urine and stools in a day. Breastfeeding babies can have loose watery stools, which is absolutely normal for the baby. And if the baby is gaining weight and feeding well and baby is active, then nothing to worry. And they also can have a little bit of jaundice, like from the 3rd day to the 10th day, the baby may be looking a bit yellow, and which can just go off physiologically. We call physiological jaundice. Also, female babies can have a peculiarity of having some white discharge and some vaginal bleed, which is due to withdrawal of the maternal hormones, and which is also absolutely normal. So these are some of the alarming things for adults, but they can be absolutely normal for newborn babies. Now, what to expect when your baby is a bit sick at home, and you can manage. If the baby is, again as I told, if the behavior is good and the baby is feeding in between, but he's sleeping a little bit more and he needs to be coaxed a little bit for the feeds, then it's fine. But there are some danger signs or alarming signals which has to be looked into, and we say that the baby needs immediate intervention by your pediatrician. The number one you can think about is we talk about is fever. Fever, high grade fever, or maybe more than 38.5 degrees centigrade to 100.4 degree or 100.4 degree Fahrenheit is considered fever for newborns. And any fever in newborns or till less than 3 months of age infants warrants a call with your pediatrician. Also, fast breathing, more than 60 per minute, or when there is some difficulty in breathing, also warrants immediate call with your talk with your pediatrician. Then the baby passing less number of urine, more than 6 to 8 hours in a day, not feeding well, missing out on 2 feeds, consecutive feeds is also dangerous. And baby not awaking in spite of the baby being given some stimulus to wake up. Also, the jaundice that I talked about. If the jaundice reaches the palms and sole of the baby, it is dangerous, and they need immediate intervention, and so they need to go to the hospital immediately. Also, when there is a change in the color of the baby, like there is some bluish discoloration or maybe pale looking baby, these are conditions, some of the conditions which I sensitize my young parents to be on the alert and call their doctor, who is actually just a call away these days. So simple, in these days of the internet, a simple call or an SMS is enough to address to these issues.